Whenever the topic of fertility comes up, it seems like 99% of the conversation is all about female health, right? We talk about eggs, ovulation cycles, and look, that stuff is absolutely critical, but it's only half the story. So today, let's dive into that other half, the part that's just as crucial but gets way less attention: sperm health.
Exactly. I'm sure it's a question that many of you have been thinking. For way too long, this whole topic has just been kind of pushed to the side, and that's created a huge gap in our understanding. So in this explainer, we are going to give it the focused, science-backed attention it absolutely deserves.
And this is exactly why it's so important to talk about. I mean, look at this. Male factors are a significant piece of the puzzle in up to half of all infertility cases. That is a massive number. You just can't ignore it. But here's the really good news, okay? A lot of these key metrics for sperm health, they're not set in stone. Not at all. They can actually be improved with conscious, consistent effort. And we're going to walk through exactly how.
Okay, so before we even get into the how-tos or supplements or anything like that, we have to get our heads around one single, non-negotiable biological fact. This is the timeline that pretty much governs everything else we're about to talk about. It's the foundation of it all. 74 days. Let that number sink in. That's roughly 2.5 months. And that's about how long it takes for sperm to be created and to fully mature. So, the big takeaway here is this. Any lifestyle change you make today, what you're eating, how you're sleeping, it's going to impact the sperm that are ready about 2.5 months from now. This isn't about quick fixes. It's a marathon, not a sprint. So keep that number front and center in your mind. All right, so when we talk about improving sperm health, what are we actually trying to improve? It's not just one single thing. You can kind of think of it like a quality inspection with 4 key checkpoints. Let's break them down one by one.
First up, we've got the count. This one's pretty straightforward, right? It's the total number of sperm. The World Health Organization sets the benchmark at over 39 million. And yeah, more can be better, but just having a huge number of them doesn't automatically mean success. It's just the first piece of the puzzle.
Next is motility. You see, it's not enough for the sperm to just show up to the party. They've got to be able to move with purpose. Can they actually swim? And more importantly, are they swimming forward, making progress towards the goal? Because sperm that are just twitching in place or swimming in little circles, well, they aren't going to get the job done. Then there's morphology, which is really just a fancy word for their shape. A sperm needs a properly formed head, a strong midsection for energy, and a powerful tail to actually swim. Now, here's what's really kind of wild about this. The benchmark for a normal sample is that only 4% need to be perfectly shaped. 4%. So perfection is not the goal here, not even close. And finally, there's a really important metric that often gets overlooked: DNA fragmentation. This is all about the quality of the genetic package inside the sperm's head. I mean, you could have a perfect-looking Michael Phelps of a sperm, but if its DNA is all damaged, it's like trying to build a house with a ripped-up blueprint. It's a huge deal. Okay, so before we jump into what you should do, let's just quickly talk about what you probably don't need to worry so much about. Because, man, the internet can be a total minefield of anxiety when it comes to fertility. So let's clear the deck and bust a couple of the biggest myths so you can focus your energy on what actually works. All right, first up, the infamous laptop myth. Everyone's heard this one, right? The idea is that the heat from your laptop is just cooking everything. And look, it comes from a place of truth. Heat is bad for sperm, but it's all about the degree of heat and how long you're exposed to it. The little bit of warmth from a laptop on your lap every now and then is not the big bad wolf it's made out to be. The real villains are the chronic, intense heat sources, like soaking in a hot tub every single day or spending hours in a sauna. And then, of course, the age-old debate: boxers versus briefs. This is another case where a tiny little kernel of truth has been just blown way out of proportion. Sure, there might be a minuscule temperature difference, but study after study shows it's really not significant enough to be your primary concern. So the bottom line? Focus on avoiding those major, prolonged heat sources we just talked about, and don't stress over your underwear. Seriously, wear what's comfortable. So now that we've cleared away some of that noise, let's get to the signal. This is the real meat of our explainer, a powerful, evidence-based strategy. I want you to think about it like a pyramid. We're going to start with the most critical, foundational things at the bottom and build our way up to the fine-tuning at the very top. And here's what that pyramid looks like. The base, the absolute non-negotiable, is thermal regulation. Then we build on that with your dietary foundation and toxin elimination. And then we fine-tune it all with stress, sleep, and finding that exercise sweet spot. So let's break down each tier, starting with that all-important base. Tier 1. This is probably the most direct and impactful strategy of them all, just keeping things cool. I mean, there's a biological reason the testes are located outside the body. They need to be a few degrees cooler than your core body temperature to work their best. It's really that simple. This just means avoiding those long, hot baths, staying out of the sauna for extended periods, anything that chronically heats up that area. It's simple, it's free, and it is incredibly effective.
Moving up to Tier 2, let's talk about your dietary foundation. Sperm are actually really vulnerable to damage from something called oxidative stress, and the best defense against that is a diet that's packed with antioxidants. So think of your food as a protective shield. Zinc is crucial for sperm formation. Folate is essential for healthy DNA, and yes, men need it too. And omega-3s help build the actual structure of the sperm. Getting these from food first is always the best way to go. All right, Tier 3 is all about removing roadblocks. This means getting rid of the things that are actively harming sperm production and quality. Now listen, if there is one single thing you can do for maximum impact, it's quitting smoking. It has been shown to directly damage sperm DNA, no question. Heavy alcohol use and recreational drugs are also major problems. This really shows how our external choices can have a massive internal impact. And finally, as we get to the top of our pyramid, it all comes down to finding your balance. Chronic stress and not getting enough sleep, that just wrecks your hormones, including testosterone. And with exercise, it's about finding the Goldilocks zone. Being a total couch potato is bad, but believe it or not, super intense, extreme exercise can also temporarily lower sperm quality. The sweet spot is moderate, regular activity. These top tiers are all about creating a stable, supportive environment inside your body.
Okay, we have covered a ton of ground. But knowledge is only powerful if you actually use it. So let's pull all this together into a simple, straightforward action plan that you can start using today. Here it is, your 5-point checklist. It's that simple. 1. Manage the heat. 2. Fuel your body with antioxidant-rich foods. 3. Cut out the major toxins, especially smoking. 4. Make sleep and stress management a real priority. And 5. Find that healthy middle ground with exercise. Remember, you're not aiming for perfection. You're just trying to create the best possible environment for your body to do its job.
And please always remember this. This is not about some radical, overnight overhaul of your entire life. It's about making small, smart, consistent changes. Because over the course of that 74-day cycle, those little changes add up and compound to make a huge difference. Consistency really is your superpower here.
So with all that in mind, I'm going to leave you with this one question. Your next 74-day cycle, it starts right now, the second you decide to act. So looking at that pyramid of priorities, what's your first step going to be?